All right, so welcome to you. Good afternoon, good evening, depending on where you're joining us from. It's always a pleasure to have you here with us for our daily lightning sessions that run from Tuesday to Friday at 6 p.m. Geneva time. So today is our 7th daily lightning session, and it's the 6th of August 2020. Greetings to you, Sohini Sanyal from New Delhi in India. Great to have you with us. Greetings to you, Emmanuel Musa from Kaduna State in Nigeria, and Dr. Timothy Ike from Nigeria too. Hi, Colin Hardy from the USA. Great to know that the USA is represented in today's session. And as you all know, while you join, it's always important for you to type in your city and your country. And I see so many people have already done so. But while you're doing so, ensure that in the chat, your message is addressed to, you're sending it to all panelists and attendees. And so I greet you, Dr. Tanvi from Delhi in India, and you, Seobong Ikpat from Nigeria. You typed your messages in the chat only to the panelists. If you could do so to all panelists and attendees, so that all those who are in the room will be able to see your message. And hi, Ruth Alote from Accra, Ghana. Greetings to you, Edgar from Kisumu, Kenya. And remember, we have the Q&A icon. If you have any question, you just click on that icon to ask your questions, and we'll be delighted to read them and attempt answers to them. So this week is Ideas Engine Week 2, and we've been focusing on ask you to focus on finding specific experiences and ideas that are useful to address your challenge or innovate. And also for those who are not yet been able to submit their ideas in the Ideas Engine, you also have this week to be able to catch up, so you can still submit your ideas in the Ideas Engine. And once you have done so, go ahead and review the ideas, go through the ideas that your peers and other scholars have already submitted, and see if they could be very useful. And I'm sure you'll definitely find useful challenges there that could help you to, useful ideas there that could help you to face the immunization challenge that you are going through in your country. So right now I'm going to invite Dr. Francois Gaz. The strategic challenges that are highlighted in red are the ones that we want to focus on today. So I'd like to invite Francois Gaz just to tell us in a few words, why face these strategic challenges? Why do we need ideas to face these strategic challenges? And how can those ideas, how should those ideas be formulated in a way that they will be helpful to all those who will be reading them? While Francois will be speaking, I'll invite you, if you are concerned with any of these strategic challenges and you have submitted an idea in the Ideas Engine based on these, I'll invite you to raise your hand, and I'll be honored and delighted to invite you to unmute yourself. Over to you, Francois.
Thank you, Charlotte, and hello to everyone this afternoon, or early morning for some, or late at night for others, to be part of this session where we hope to hear from you some concrete ideas that we'll all be clear about, that will be helping you to the challenge that you are facing in your country. I'm sure that everyone with the pandemic face almost all those challenges, but maybe some are more important than others. So you may choose one of those, an idea that you have developed and maybe put and hopefully put on the Idea Engine to overcome one of those challenges. You know, when you're challenged, some are always more important than others. So it would be nice to hear how you're going to address it in practice, and in sufficient detail that everybody listening to you is able to capture your idea, your main idea, and all the steps you have taken in practice and implemented to overcome your idea, to overcome your challenge, and particularly also, how do you monitor and assess that this idea implemented, when implemented, give you the expected results, if you have already some information about it. So it will be important when you present your challenge, you stress where you are working and what are the areas you try to address this challenge in practical terms, because you may be at different level of the health system in your country. So it's important to know where you are, what's your responsibility, and where you're focusing your ideas to make them resolve those problems. So feel free to choose one of those three main areas. Every week we will change the area of focus in order to cover ideas for all those challenges listed by Charlotte, which have been raised by you when there was a famous survey. So looking forward to hear one of your ideas on those three priority challenges. Over to you, Charlotte.
Thank you very much, Francois. We are 5 minutes past 6 p.m. Geneva time, and I see there are already 2 raised hands. I just want to say warm welcome to Aurangzeb Mughal from AGK Pakistan, for the welcome Dr. Umar from India, welcome Mohammed Imran Qureshi from Pakistan, and just I'm going to invite you, Salihuma, to unmute yourself, and then you have the floor.
Good evening, colleague.
Good evening.
Yeah, my major challenge is I'm here to submit my ideas to ideas engine room, and I miss with one exercise.
Please, can you first of all introduce yourself and tell us where you're calling from?
My name is Salium. I'm calling from Nigeria, Katsina State, Nigeria.
Okay.
Hello?
So, yes, we are getting you.
My major challenge, yes, I'm here to submit my ideas to ideas engine room, and I also miss with one as exercise. That is what I need a guide. How I will do, I will check out the assignment, and how I will be able to submit my ideas to the ideas engine room.
Okay, thank you very much for asking that question, Saliu. I thought you wanted to share already your idea with us, and you can still do so even if you haven't yet submitted it in the ideas engine, if it has to do with one of the 3 strategic challenges that are highlighted there. But just to tell you, you have not missed week 1 exercise. If you can see my screen, you will notice that we are in ideas engine week 2. Ideas engine week 1 require that you join the ideas engine, you explore and share experiences and ideas. So you were expected to share your idea last week in the ideas engine, but we postponed it. We added this week also. So because of the many incredible ideas that were received on the ideas engine, we thought, okay, there should be more scholars out there who have more interesting ideas to share. And so this week you have up till tomorrow to be able to submit your idea in the ideas engine. Is that okay?
Yes. How do I get the link to the ideas engine room? I need the link.
Okay, there was a mail that was sent in that regard. But one thing I also know is that you are part of the Nigerian country group. So I'm sure there are scholars, Nigerian scholars in the room who will be ready to help you. We are running out of time in this session, and also advise you to attend the technical support session tomorrow with Dr. Alain Blaise Tatsinku. But I will locate the links and share them in the chat for your benefit. Okay. All right, so thank you very much. So right now I'm going to directly invite Umar Nazir. Umar Nazir, if you're getting me, please, can you unmute yourself and you have the floor.
Good evening, everybody. I'm Dr. Umar. I'm the zonal medical officer in my area. I have an idea to share with you about the safe and effective immunization. That's strategy number 2. What I'm doing, I have implemented from the last.
Excuse me, doctor, please forgive me, but I want to know, where exactly are you working? Where are you calling from? Which country, state?
I'm working in India. I'm working in India and in the state of Jammu and Kashmir.
All right, thank you. Okay, so please go ahead.
I'm a postgraduate in the Department of Public Health. I'm working in charge zonal medical officer of the hospital. I have an idea to share with you about the safe and effective vaccination campaigns which I am trying to implement at my hospital. Before going to the immunization section, first of all, what I used to do is that every healthcare worker is to be getting screened before entering the immunization section. So we are screening by the infrared thermometer. After that, we let him, if he is febrile on the infrared thermometer, then we let him to go inside for the immunization. After that, all the SOPs, that's wearing a face mask, triple layer mask, and that we follow, and we also wear the gloves, and we put the PPEs also are always there with them. After that, we make a social distance at least of 6 feet for every child to get immunized. And we check at the door side. We have kept a healthcare worker who screens for the temperature of the child as well as the pregnant ladies for getting immunized. So after following all the SOPs, we let the child to come inside and get immunized. So by this we have seen that the children who are febrile and who the healthcare workers are screened at the entry point of the immunization. If they are febrile, we don't let them to come into the immunization, and we have our supplementary healthcare workers who are, if they are available, so they are taking role of immunization at that day. And simultaneously, by this we are trying to reduce the risk of getting COVID infection to other healthcare workers, as well as simultaneously we are keeping the baby as under 5 children and pregnant ladies who are getting immunized during the immunization safe. And after every session, we used to discard all the materials we use as per the Biomedical Waste Management Act. So this is the way we do at our level. So we never let any healthcare worker to enter the immunization before he gets screened outside for a fever illness like that. So this is my idea I am sharing with you. Thank you. Any responses, you can call me. Hello.
Oh, sorry. Thank you very much, Dr. Umar Nazir. Thank you for being brief and concise. So at this moment, I'm going to invite Dr. Francois Gaz if he has any comments and questions for more clarity.
Thank you, Dr. Mayor. I thank you for sharing your experience to try to make health worker and mothers safe from COVID. My question, and you described clearly that you have SOPs and you check that no one escapes the SOPs, and you are focusing as much as your health worker as your mothers, as the mother to come, and that's a very interesting new idea. And one thing I'm interested, did you do that in prevention, or did you do that because you had a problem and women were not attending before they were fearing to be infected? When did you start this sort of approach?
This approach we have started from the day the WHO has declared WHO declared the COVID as an emergency of international concern. From that day, we have started this thing that whenever we start our immunization, we first do screening of our healthcare workers. If they are found febrile, if their temperature is below 100, we let them go inside. If it is above 100, we stop our healthcare, and simultaneously we start doing their testing as well as for RT-PCR for COVID-19. So we don't let them to go inside. Simultaneously, whenever their mother comes with their child for immunization, we first off screen the mother as well as the child if they are febrile or not. If the child is febrile at a time, definitely we will not do the immunization of the child. And simultaneously, if the mother is also febrile, we don't let that mother to accompany the child to the immunization. We tell her, you bring your other parent, second parent with the child, so that he get immunized. And simultaneously, as we know, this is a pandemic is going off COVID-19, we work out with that mother and screen for COVID-19 in our hospital setting, because we have every week we do testing, because this hospital is not a big institution. We have once or twice in a week we do COVID-19 screening RT-PCR at our hospital.
Okay, now you mentioned you were working in an hospital. Was this an approach, an idea used by all hospitals, or was it an initiative in your local hospital?
No, this initiative is based purely on the local local level. This has I have started at my hospital, and some of the hospitals in my block have replicated it now from some time. Initially, it was me who started this.
Now, tell me, so when you started, there was no problem for women and children to come and get immunized. So did you still, in spite of your efforts, see a drop of attendance by women coming for immunization or not? Did you make only a
Uh,
preventive and it worked?
and no, 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 no. The parents are because the way I work, the parents are well educated and they know what we are going through right now in the pandemic. But they don't want us also to let the guards down in under 5 children. They want their child to get immunized from all the vaccine preventable diseases. That's why they are very cooperative and they come and follow the SOPs and then enter to the immunization section if they are suspected that they have fever like that, and they bring the second parent to the, and they call him on the phone and tell him to come accompany because I am feeling I have been screened for the temperature and I am febrile, so I can't. They are not letting me out in to the immunization. And the second parent comes if he is also he comes febrile on the infrared. We let the second parent to accompany the child and get the child immunized after screening after screening the child also first.
Thank you very much. So you did that as a preventive measure, and it seems to
Yeah,
have.
yeah, yeah. It was totally a preventive measure to reduce the risk of COVID-19 to the healthcare workers, simultaneously add to the mother as well as the children.
Okay, thank you. Over to you, Charlotte.
Okay, thank you very much to you, Dr. Francois Gas, and to you, Umar Nazir. And I'm sure that if there are still some health districts or regions or states that have not yet been touched by COVID-19, this idea shared will be very useful to them so that they will totally, that is a preventive measure that will work for them. So there was, on the chart, there was an indication. All right. So now I see another hand raised. Rabiu, yes, I see Rabiu Abubakar, your hand is raised. There were other raised hands that have gone down, I'm sure. And Tanushri Mondal, you actually indicated that you wanted to share your idea in the same line that is concerning strategic challenge 2, like Umar Nazi. So I really want you to focus on what are you doing that is different from what Umar Nazi has presented. Over to you, Dr. Tanushri Mondal. Dr. Tanushri Mondal.
Yes, can you hear me?
Yes, we can hear you, but your volume is so low. So can you increase the volume of your device?
Yeah. Is it
All
better
right.
now?
That's much better. Thank you.
Okay, thank you, Charlotte. This is a good evening from India. I'm from West Bengal, India. So, what I'm going to present this idea, it is upon the safety, the health worker safety in delivery of immunization practices. And this is actually not in the implementation phase, it's ahead. So I just wanted to blurt it out. Now, what I was thinking about is since this corona, we have the health issues. There is a lot of social isolation. There is fear of contracting the disease, and many of the health workers, they are actually contracting the disease, as a result of which there is, lack of man force, I mean human man force in the in health sector. So this is causing an immense problem. So what I was thinking is, pitch in the GIS technology, the geographical information system into it. Now that's in the initial phases, what I'm thinking about is that if we can pitch in, we have GIS technology called the software called GIS Connect. So we can see which areas are affected, those where immunization practices are at fault, or maybe it is suffering because of the corona pandemic. So we can target those areas. And I was thinking of use of drones rather for taking the valuable information, and application of robots. Now what is the applicability of robots? Now once I was seeing that in Australia, they had used this robot in some dissemination of information. So we can do that dissemination of information which the health workers were doing house to house. And number two, we can also provide masks as well as sanitizers to those who are the mothers, the health caregivers. And I was also thinking about like if can have any system where the immunization card will be, it will have some system where the technology which we used in 99 dots in India. That means in 99 dots in India, which was used for tuberculosis, once a patient takes the medicine, there was a phone number, and once he rings it up, it goes immediately to the dashboard. If he is not taking it up, then the health worker in turn rings that person and asks him that have you taken the medicine, or if not, then why you have not taken, please do. So if we can develop such a mechanism, I don't know how far it would be feasible, but I think that we can narrow down that if in case of immunization, those who are not coming to the immunization clinics for the fear of contracting disease, so if we can do, if we can apply the same technology, then I think these those who are suffering as a result of this corona pandemic, they are missing. And in many of these instances, we have seen that those who have missed their doses, when they come for the next session, so they are not being provided, they are not provided that dose. So we can avoid such kind of calamities in this, it is a disaster, so we can manage this disastrous period through application of certain things like this. Above all, we have another app in operation called the Kobo Collect. So I was thinking if we can apply this Kobo Collect by the health workers to take, information on the areas and send it to the dashboard. And, this could be help to the GIS system. So it's like sketchy in my mind, but I'm thinking I need some technical, experts to help me out with this thing, because it's not my domain at all. But if we can pitch in together, then I think that we can solve a lot of problems in this pandemic. Thank you very much.
Thank you very much, Dr. Tanushri. And I see these are the ideas you're talking about. Just to know, have you shared any idea on the ideas engine?
Yes, I have shared this idea, and I have seen that a few of my friends over there in the peer hub, they have certain keen ideas, and we were actually we were sharing, we were reviewing each other's thing, and on doing so, these ideas were coming out one or above the other. So it's like improving day by day. So it's the improvised thing till now, and we can I hope to improvise it in the future days.
All right, so thank you, Dr. Faswa, guys. You've listened to Dr. Tanushri. What are your thoughts?
I'm like her. I'm not a specialist in drone, GIS, and dashboards experience that she shared, but it looks like she's talking about a system where you could trace all the defaulters for immunization, identify and trace defaulters. But, it's the first time I'm hearing such an idea. So maybe I will, let Shalini maybe make comment on the clarification that needs to take place, because I have many questions, but I will use the whole.
Right. Thank you.
Exactly, Francois. And before Shalini comes, I see she already asked a question on the chat on the Tanushri, drones and robots are extremely expensive. Who would fund this venture? I was actually expecting Francois to ask that question. I had to bite my tongue from asking the question. So,
right.
Shalini.
So, Tanushri, it's a very, very interesting idea, and I'm glad you came up with it, because by coming up with innovative ideas, that's what actually leads to something, you know, which is remarkable, or it could be a revolution, you know. But since what we're here to do is to help you think through, the first question, as Charlotte mentioned, that I have is drones and robos. I mean, first is, who would design them? How would they be designed? Would there be enough time to get them designed by some robotic company? And you know that drones are not easy to send. There was a study that was done in Rwanda. I think there was a pilot where they tried drones, but they were not really successful. There's also the issue of drones flying over in the airspace, which many governments are reluctant to do because of security reasons. And drones have been used for transporting blood in war-struck or you know, in natural calamity areas. So the thing is, I mean, I really like the GIS and GPS system, and that a lot of it is being done in India. But if it's only with the health workers, maybe if the health workers are provided with smartphones, then it makes sense. But do you know if all the health workers in the area that you work have smartphones? Tanushri?
No, actually, it's yeah, that is a feasibility thing. We need to, I mean, supply it to the government, because some of the projects we wanted to give smartphones or maybe tab for data collection. So in many of the projects, it did well, very well. But
Uh,
in some,
where do you work? Sorry to interrupt you. Where do you work in West Bengal?
okay, I work in the directorate in the Department of Health and Family Welfare. I'm working as the
Excellent.
assistant.
So you're working with the government.
Yes, I'm the assistant director of medical education.
That's
So
fantastic.
yeah,
So do you think this is a doable idea to get the government to give the health workers smartphones or mobile phones with GPS tracking system? And
I
would there be a problem in getting the funding?
I think that now we can do one thing. We can involve, like in some other things like rare diseases. I would tell that they're trying to pitch in the you know, the companies for with the CSR initiative. So if we can pitch in some you know, private companies for funding through CSR, I think we can do it. And the other way around, like for example, application of drones, our government has already started with that thing for, you know, its surveillance purposes. But for health, they have not yet started. And I think that when lots of money is being, you know, invested in so many things, and you know, investigations and a whole lot of things, I think that this is the need of the hour, though it needs a lot of planning and you know, for its full implementation. But we can think of, I mean, we can start thinking.
Okay,
Yes.
thank you, really. Thank you, Shalini. Thank you. The points
Yeah.
I'm seeing some very interesting comments in the chat. And Shalini, I want to thank you for reaching out to Salihu Ma in a short while ago and sharing with him the links and giving him the guidance on how he could join the IDS engine. So there are some comments here. They say to run these, trained human resources are also required, meaning to run probably the drone system, the robotics, and all of that. And if there's Arif Amadullah that says, I think it's impossible to implement in the poor and inaccessible countries or areas, also needs more fund. And Martha tends to agree with that, that it sounds good, but really expensive approach. And then there's also sustainability. And then Sohini says, drones is interesting. If there are other health services that can use one, then the drone becomes a shared resource, therefore shared costs between projects. Oh yeah. And Mercy Baka said this, but solutions like this don't get to the rural areas. It's felt more in big urban or country capital. All right, just to say, Dr. Tanushri, or we all agree it's such a great idea, but within the context of context of the ideas engine, where we really want, we are in an emergency situation facing COVID-19 where response has to be rapid. So ideas need to be those that people can actually implement them without securing extraordinary additional cost, because we have to think about planning, resource mobilization, and all of that. So we may have to, this is an idea that will be good for maybe really, as you said, the government to think through, but us as frontline immunization, you who are frontline immunization professionals that are here, they want maybe they want ideas that can actually enable them to solve the day-to-day problems that are facing. But I like these ideas, and we all agree that this is a great idea that you have proposed, and I think it should be it will be good to share that idea with the authorities. So thank you very much, Tanushree. And I'll just, all right. So there is Sabitu Sanusi. Unfortunately, it's already 6:30 Geneva time, but Sabitu, your hand has been raised for a long while, and I really want you to share. Unfortunately, Sabitu, we just lost you. While I was saying that, I was going to give you the possibility to unmute yourself and share with us what you have in mind. Unfortunately, we have lost Sanusi, but it's already we are already past the 30 minutes time that was scheduled for this session. But there was a question on the Q&A that is from an anonymous attendee that said, when will the rubric, probably when will the rubric be shared? So just take part in the next Monday's Global Assembly, which will be exercise week 1, and you'll get the information concerning the rubric. All right, so I'm going to turn Kurajuf, your hand is raised, but unfortunately we are over time. So tomorrow we'll definitely, if you want to share your idea that's based on the 3 challenges we have identified, I think tomorrow we could still take care of these challenges, because we still have to hear about organization of catch-up services, and also human resources, availability of human resources during this period. Okay, I see there's Colleen Hardy that's joining from the USA that said maybe can partner with organizations like Zipline in USA, working in Tanzania, Ghana, and a few others. So there is a link that is shared. So I'm sure, Colleen, maybe I could just invite you to, in 2-3 words, to tell us what Zipline will be able to do for scholars that are part of the COVID-19 Peer Hub. So Colleen, I've invited you to unmute yourself, and then.
Can you hear me?
Yes.
Okay, so there's an organization, it's a company called Zipline, and possibly if somebody comes forward with a proposal, they may be interested in developing further. I do know that they work in a few countries and deliver it's for blood donations, but they may be interested in expanding, and so it would be worth, if someone's interested, to reach out to them. Over.
All right, so thank you very much. And I see Sohini actually says in some part of India, Zipline drone have been used. So really, thank you very much to you, Colleen, for bringing up that proposal. And that is one of the reasons why we have the COVID-19 peer hubs, to be able to get ideas such as this. Thank you. Thanks to you, Dr. Tanushree. Thanks to you, Umar Nazir, for sharing your ideas today. I'm going to invite Dr. Francois Gaz to give us his closing remarks, and then Shalini is going to close the session for today. So looking forward to seeing you tomorrow at 6 p.m. Geneva time for another interesting daily lightning session. Over to you, Francois, and then Shalini for the closing.
Thank you, Charlotte, and thank you for the 2 presenters of ideas. I think we have clearly great ideas, which are, as Charlotte mentioned, sort of long-term, and they may serve many purposes in the future, and maybe that's the way of the future, to trace outbreak, to control the implementation of control measures with drone, with pictures, you know. But this is maybe more long-term and a great idea. Now we're facing an emergency, and we lack time, and we need to make sure that we have the minimum of children victim of not being immunized for all sorts of reasons and all the challenge mentioned. So basically, I think the focus should be more on the short-term issues, while not eliminating long-term issues that will be useful in the future. And on those short-term issues, look at really being realistic on what can be done, taking into consideration the local situation, the rural or urban areas, your health infrastructure. Try to be really realistic, and then we share as much as possible the detail of implementation, but because this will help others to really understand what you have done in practice, like we have heard about the SOPs and the triage of health worker and checking both health worker at the entrance. And those are very concrete ideas that can be put in practice relatively rapidly and shared. And make sure when you share the idea on the idea engine that you respond to the questions which are listed with enough detail for anyone who go in the idea, get interested, know exactly what you have done, how you have done it, with whom you have done it, at what cost you have done it, and eventually make comment and ask you, individual of your ideas, more questions to get more information about it. So thank you very much for this sharing. Looking forward to more ideas in the coming days.
Okay, thank you, Francois. Over to you, Shalini.
So thank you so much, Charlotte, and thank you, Francois, and thank you to the presenters. It's always a treat and a pleasure to listen to your ideas, and some are absolutely innovative, which makes it so special. But as Francois said, I would just say one go that what you need to do is really think through and start answering the questions and going to the nitty-gritties, as in how would you do it and where would you do it and who would you do it for and who would fund you, and all these things should be considered. And if there are some tried and tested ideas, it would be great if you could mention about them in your ideas that you're posting. So thank you very much. Thanks, Charlotte. Over to you.
All right, thank you, Shalini. Just to say, we have listened a lot of ideas from India this week. So tomorrow, I just pray that we'll give the opportunities to others from other countries and other regions to share their ideas. So my dear Indian scholars, just bear with us tomorrow. So we'll give a privilege to others who are coming from other regions so they can also share their ideas. Thank you. Let the ideas keep flowing. The ideas engine is still open. Vote for the ideas that you find the most relevant in your context, and look forward to seeing you tomorrow. Until then, just have a nice evening, a nice afternoon, a nice night, depending on where you're joining from. Bye for now.
Bye. See you guys. Bye.
Thank you. Bye-bye.